visible, identify any symptoms or complication. The do's and don'ts for the IV cannulation: look for the right veins by feeling rather than visualizing them, and start the IV in the lowest veins and work upward, and follow all the aseptic precautions, standard precautions, everything. And choosing the right size of cannula is also very important. And what are the don'ts? Avoid thick wings. Do not cannulate at the joints, yeah, at the bifurcations, and avoid penetrating furthermore because that can be causing counterpuncture. Do not prop the vein, and do not forcefully push any flushing materials or IV fluid or medications, and avoid heparin flush unless it is indicated. Right. Okay. So once you do the cannulation, flushing protocol has to be compulsory followed. Why you have to do flushing protocol? Why do we have to flush the lines? Whether it is PIBC, PIC lines, mid lines, or CDC, whatever it is, chemopods also, we have to flush it. Why are we flushing it? Yes. To maintain the patency. मतलब है कि कुछ तो nothing should be remaining in the catheter या in the blood vessel. अगर हमने कोई वेसाइटिन medication भी दिया हुआ है, या no medication should be staying in the line so that the catheter won't be getting blocked, right? And the medications also won't be staying at the catheter. So when and all you have to flush before and after, right? Before you access the IV line and after you complete the therapy, हमको flushing करना ही पड़ेगा. Which solution should be used? Which normal saline? There are so many concentrations in normal saline. Yes. 0.9 percentage of normal saline, and that should be preservative free. Okay, that is also very important. 0.9% in the normal saline, preservative free, should be used for flushing. Heparin should be avoided. Heparin will be used and whether as a doctor's order, right? Depending upon the patient's condition, then only heparin should be used. Otherwise, compulsory 0.9% of preservative free normal saline should be used. कितना use करना होता है? How much will you take? 5 to 10 ml. Minimum 5 and maximum 10 ml, depending upon what type of medication or what type of fluid आपने administration किया हुआ है, right? So flushing is very important before and after flush करना पड़ेगा, right? And again, 0.9% of preservative free normal saline use करना होता है. No distilled water, sterile water, tap water और heparin कुछ भी use नहीं करना होता है, right? And minimum 5, maximum 10 ml भी use करना होगा. And do not forcefully flush the line. It can also causes the micro movement in the catheter. Okay, so do it in a soft and easier way, right? And again, within how many within how many days will you change the cannula? What is the indwelling time? 48 to 76 hours and 96 hours. Okay, what is the criteria? अगर आपको 96 hours तक continue करना है, what will you do? VIP score should not be more than 2. Should not be more than 1. Yes. So can anyone tell me what is a VIP score? What is the full form of VIP? Visual infusion phlebitis scoring. Are you all following it? Yes. Compulsory follow करना पड़ेगा. Even before you give flush, you have to assess the VIP score. If there is presence of redness and swelling, you cannot give flush. क्योंकि VIP score 2 तो हो गया है. You have to remove the cannula and reside the cannula, right? So you cannot continue with the flush. So always remember, VIP score का monitoring every time आपको करना ही पड़ेगा. It is not once in 6 hours or once in your shift. Whenever you are accessing the lines, PIC lines, mid lines, CDC, near the peripheral cannula, whenever you are going to give medications or fluids, तब आपको VIP score monitoring करना ही पड़ेगा, right? So always remember, VIP score, always it should be 0 या 1. If the score 2 हो गया है, you have to remove the cannula and reside the cannula, right? What is the total score? VIP? 5. And what will happen at the score of 5? Palpable venous cord was already in the 4. So what will happen in 5? Pyrexia. And what is pyrexia and why pyrexia is coming? Infection. Catheter associated bloodstream infection have already been started. And who is the problem? Who is the root cause? It is us. Yes or no? We have never noticed. हमने neglect किया है. That the score was 1. हमने neglect किया था. तब हमने notice नहीं किया था. And we didn't even make any measurements over there. What is the problem and how do we manage the problem and how will you prevent? No, it will be going to be 2, right? So if we have done at the score of 1, these should not have happened, right?